Hello, I'm Jim Demo with Clark County Close-Up. Thank you both for meeting with us.
Thank you for having us here.
Okay, Brianna, we'll start with you. Why is it important for kids to be immunized before they go back to school?
Yeah, so there's a few reasons why that's important. First off, so that they have protection before they enter the school setting. School settings are what are known as congregate settings because there's a lot of different people there. There's a lot of children there. So the chance of a child being exposed to a vaccine-preventable disease is higher in that setting. The second reason is so that you have time to get your kids immunized. A lot of parents have more free time in the summer. You don't have to pull your kids out of school to get them to the doctor for those immunizations. So it's just easier to do before school starts. And then the last reason would be because kids, once they hit 30 days in school, it's the law in Washington State, if they aren't up to date on their immunizations or haven't provided a certificate of exemption, then they can be excluded from school. So you don't want to run into that 30-day deadline either.
So get them immunized before school starts.
Right.
Okay. All right. So what is the Vaccine for Children's program, and how does Clark County administer it?
Yeah, so the Vaccine for Children program, it's a program that was created back in 1993. It's a federal program that was created under the Clinton administration to provide vaccine to kids that might otherwise not be able to afford vaccines. Here in Washington State, we're fortunate. We also have the Washington Vaccine Association that provides funding to provide vaccines for all children. So regardless of insurance status or ability to pay, all children could get immunized and get the vaccine for free here in Washington State. At Clark County Public Health, we just work with our community providers to be able to administer the program. So kids will see their regular doctor to get the vaccines through the Vaccines for Children program, and we work with them to make sure they have access to those.
Okay. Now, Alan, why do some schools in Clark County have a relatively high vaccine exemption rate?
So let me describe what we mean by exemption rate. So there are three ways that people can basically exempt or not have their kids bring them to school without having the vaccinations in place. One is a religious exemption. You can get based on your religious background, you can exempt your children from getting the vaccines. Another one would be if your child had a medical contraindication. For example, if they had some sort of immune deficiency and couldn't get a live vaccine, that might be a medical exemption. And then the third type of exemption is like a personal exemption, or what I like to call a philosophic exemption for parents who may not believe, for whatever reason, they believe that vaccines are all harmful, they don't believe they work. The vast majority of exemptions are the philosophic exemption. There are very few religions that would ban vaccines, and there are very, very few medical reasons why you can't be vaccinated. So the vast majority are philosophical. The schools, the different schools in the county reflect the families that live in the area around the school where the kids go to school. And there are some communities where there's a higher concentration of people who either believe vaccines, and I believe are misinformed, believe vaccines are harmful, or believe they don't work. So some schools have a higher concentration of families or parents who feel that way. So it varies. The exemption rate varies from school to school and from neighborhood to neighborhood.
So if a parent claims exemption for their kids, what happens at the school when there's an outbreak of a vaccine-preventable disease such as chickenpox?
Yeah, and let me just, if I can just interject, because I left something out there. To get that philosophic exemption, the parents are required to have a conversation with their doctor, their healthcare provider, and get the information. So I'm sorry I didn't include that earlier, but so they've heard the information, they still choose not to vaccinate their children. When there is an outbreak at school and we have children who are unvaccinated, and again, the majority of them are philosophic exemptions, we can actually exclude the children from school for the duration of the outbreak until the outbreak is over, until there's no risk of transmission anymore. And given that some of these diseases have what we call long incubation times, the time from when you are exposed to when you might develop symptoms and become contagious, that can be as long as several weeks. So children who aren't immunized can be excluded for a long time. We do that to control the outbreak. And the other point I want to make about that is that if the parents are willing to get their child vaccinated, they can go generally, depending on which disease we're talking about, they can immediately return to school. So they don't have to be out for that long a period of time.
And we're talking about diseases that can possibly kill a child. I mean,
yeah, the diseases we're talking about, we're really serious about. I mean, measles can kill 1 to 3 per 1,000 people who get measles can die of the disease. We're talking about diseases that have horrible complications, including with measles, you can get infection of the brain, inflammation of the brain. People don't, I'm not sure people remember that before we had vaccines, there were hundreds of thousands of cases of these diseases every year in the United States, with thousands of deaths. I remember when I was in training, because I've been around a long time, before we had the Hib vaccine, we had cases of what's called epiglottitis, Haemophilus influenzae, bacterial infection, that causes the little flap over your airway to swell up and block your breathing. If you've ever seen a young child with epiglottitis where they can't breathe, it's frightening. And we don't see things like this much anymore. I mean, now we have a measles case, it becomes news, but in the past there were thousands of cases every year in the United States with hundreds of deaths from measles alone. We don't see that anymore because we have higher vaccination rates.
Okay. Brianna, how does public health work with schools to contain an outbreak of communicable diseases?
Yeah, so that really depends on what the disease is, what we're looking at. Is it measles? Is it chickenpox? Is it mumps? What's in the school? But in general, we'll work with the schools a lot before an outbreak happens. So we want them to be prepared. We want them to be tracking, of course, students' immunization status, but also tracking their staff's immunization status so they know who's protected and who's not on demand as soon as they need to know that information when an outbreak does occur. When an outbreak does happen, when we have cases in schools, we'll work with the schools to identify that they do have an outbreak, and then also work with them around control measures. So do they need to do extra cleaning? Do they need to exclude children? What do they need to do to help control that spread in their school? From there, we'll help providing with letters and stuff from Dr. Melnick and from our communicable disease manager, help provide letters that they can send out to students and to staff and their parents, and let them know that they need to be excluded and for how long and what they need to do to get back to school. And then we also help them just to kind of track the data. That piece can be pretty big as well, to track when do they, again, have an outbreak, identifying that outbreak, and then identifying additional cases involved in the outbreak, and then declaring when that outbreak is over, so knowing when transmission has ended. For individuals, we can also help if they're having issues with accessing treatment or accessing immunizations. We can help to link them to care as well and be that resource for people.
Great. Now, what do you say to people who resist vaccination for their children, claiming they might cause autism?
So the first thing I would say is vaccines don't cause autism. That is a well-known fact. There's been a lot of research into that question, and it just hasn't played out. The research doesn't show that that is true, and that research has been done all over the world. There's been large studies. The way they look at issues like that are they look at a population of immunized kids and then a population of unimmunized kids. And we look at the rate of autism amongst those two groups, and we can compare and see. And it's not just autism that they do that for. Any question about immunizations, that's the initial research that's done. Are we seeing higher rates in kids that are immunized versus kids that aren't immunized? And then also just looking at, is it even plausible for this vaccine? How does the vaccine interact with our body? Is it even plausible for the vaccine to be causing autism or any other thing that people might say about vaccines? But how do you respond as a parent? Again, that first thing I would say is, I really don't believe that vaccines cause autism, and here's why. Keep it non-confrontational. Just share why you vaccinate your kids and why you feel that vaccines are important to yourself and your family, and also to our community at a broader level. And keep that conversation open. It's okay to listen to their concerns. Say, where did you hear that? Can you share your sources with me? And then you've got a lead to be able to investigate that further and maybe provide some counter evidence, and just share what you've read about vaccines and why you've made your decision. You know, here, hey, I saw this news article the other day. What do you think about it? And keep that conversation open. Keep in mind, too, that people aren't going to change their mind during that initial conversation. If you think about any health or behavior change you've tried to make for yourself, typically you don't have that light bulb moment, you know, in the initial conversation that somebody had with you, but you need to go home and mull it over a little bit. So just because a friend or a family member or an acquaintance doesn't change their mind based on that one conversation, don't just give up that conversation.
Alan, do you care to speak about how safe vaccines are?
Vaccines are incredibly safe. So, you know, the main side effects that you can sometimes see are some fever and some pain around the injection site. But the serious side effects, I mean, we're talking like 1 in a million or less. The serious side effects of vaccines are really rare. I want to contrast that with the side effects, and not really side effects, with the diseases they prevent. I mean, we're talking about diseases with a high level of serious complications. I already mentioned measles, I mentioned Haemophilus influenza, we talked about polio a little bit. We're talking about diseases that are deadly, and we used to have, in the United States, we had thousands of deaths every year from vaccine preventable illness. Now when we have that, it's a major news event. So the vaccines are incredibly safe. In fact, I'd say in terms of, you know, as a physician, in terms of the medical interventions we have, vaccines are probably one of the most, if not at the top, of the safest yet most effective treatments we have in terms of disease prevention. So we're talking about something that is incredibly safe.
Let's talk, health experts talked about high vaccination rates are necessary to create herd immunity. Can you explain what that is?
Yeah, that's a really good question. So basically, the more people you have in a population or a herd that are vaccinated, the less likely you are to get transmission. What happens is, if most of the people, the large proportion of people are vaccinated, when the virus gets into the community, it hits a bunch of dead ends. It hits somebody, but they're vaccinated, so they don't get the disease and they can't spread it to other folks. Now, it really matters a lot. Herd immunity matters a lot because you need for diseases like measles that are exquisitely contagious, you need a large number to prevent transmission in the community. You need a large number of people, large proportion of people to be vaccinated. So with something like measles, you need over 90%, probably around 95% of folks to be immune to the disease, to be vaccinated. When you get below that, you start seeing outbreaks. And one of the things I tell folks is, you know, when you get vaccinated, you're not only getting vaccinated to protect yourself or your child when you vaccinate your child, we get vaccinated to protect everybody around us. The way we were able to basically get rid of smallpox is we created worldwide herd immunity. We got enough people vaccinated for smallpox around the world. That is the biggest herd you can think of, is the entire population of the world. We eliminated smallpox. That's what herd immunity can do. If we're getting close with polio, but if you get enough people immune, the disease has no place to go. That's what herd immunity is all about.
Okay. Brianna, we've been talking a lot about getting kids immunized. What about adults?
Yeah, so adults actually need vaccinations too. A lot of adults don't think about that, especially adults around my age. People that are middle-aged don't think about it, but we do. Every year, adults should be getting their flu vaccine, and then every 10 years, adults need their Tdap booster as well. And then there's other vaccines that you might need.
Could you say?
Oh, yeah.
Tdap?
The Tdap, so that protects against tetanus, diphtheria, and pertussis.
Okay.
So it's important for adults to have that, especially if they're going to be around new infants. And it's also important based on medical conditions that people might have. So if a woman's pregnant, it's recommended for them to get the Tdap as well to protect their baby against pertussis. They can transmit those antibodies to their unborn baby, so they've got some protection when they're born. And then adults that are going to be around that baby, we call it cocooning. So you protect that baby by protecting the people around that baby. So going back to the herd immunity that Dr. Melnick just talked about, you want to make sure that we're protecting everybody. Also, if adults are traveling, there's vaccinations that are recommended depending on where you're traveling to. So that's something to look into at least a couple months before you're planning to take your trip, so you've got time to get all the doses that you might need on board. And then adults with certain medical conditions will need vaccines as well. And once adults get a little bit older, it's also important that they're getting vaccinated for things like pneumonia and zoster as well.
I just want to add that pertussis is whooping cough. So for those
Thank
folks
you.
who don't know what pertussis
Okay.
is, and the adults get vaccinated to protect, when we get whooping cough, it's really kind of nasty, and you have a cough that goes on maybe for several weeks. You may cough so hard that you vomit. Infants who get pertussis, it can be incredibly deadly. So one of the reasons all of us as adults need to get pertussis is to protect young infants who are around us. So I just make sure that we use the term pertussis a lot, but it is whooping cough.
There you go.
Okay.
Well, if people want more information about immunizations, where can they go?
So they can go to our website. I guess the easiest way to get there is probably by Google. So Googling Clark County and then immunizations. So clarkcounty.wa.gov / immunizations.
Okay.
Is the web address. And then you can also give us a call at our immunizations program. So the direct number is 360-397-8403.
Well, thank you very much for meeting with us.
Thank you for having us.
Yeah,
It's
thank you.
important to get this information out there, so we appreciate it. Thank you.